extension and radial deviation. I'm going to bring it down, across towards the opposite pocket. Now reach out and away, and down and in. So you can cue him to reach his arm out and away, okay? Like he was trying to, we didn't talk about this, functional reasons. So this is a good one for people, I've used this for people, well, I guess long ago, when they actually still had gas-powered lawnmowers, but this was a good one for people who had to pull the lawnmower cord. They were getting kind of weak, it was hard on the shoulder. You can, if you're the passenger side, this is good for people who want to fasten their seat belt. And this is again good for functional things like overhead movement and throwing, things like that, depending on the person's needs. So if you had an overhead athlete, javelin thrower, baseball pitcher, something like that. Plus it's just more fun to say, let's work on releasing the doves. So, okay, so I come underneath, thumb side of the hand and wrist. I bring the arm across. Again, if this is a lady, I'm going to be mindful of where my proximal hand is because it's right across their chest. I'm going to pivot, bring them up and out, down and in. Work on that quick stretch. In this case, because he's in a relatively flex position, you can take him in a little more, but sometimes I'll just give him a little extension flip. Because it's hard for me to facilitate more flexion. Okay? And then I'm going to show you the resisted one's harder on this one, I think. This one's really hard. So push. Out and away, push, 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 push. Pull down and in, down, 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 down. Push out and away, push, 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 push. Pull down and in. And I want to note to you that, as you guys may have learned in ortho, or you may learn today, I can't remember if it's today or next week, that this 90 degrees of A, B abduction and full external rotation, like we would use to throw, is a very dangerous position for people who have hypermobility of their glenohumeral joint. This is a position where a lot of people dislocate and they have instability. So usually, especially in the case of any previous conditions or pathology, I'm hesitant about bringing someone way out here. So usually when I do the resisted part, I only come, I would say, about 80% of the way, because I don't want to put them in that full position where they might have a subluxation, a dislocation, or any compromise to any of the soft tissues that support the glenohumeral joint. So let's practice